everyone, and welcome back to the Health Data Ethics Podcast. I'm your host, Jenny Owens, and boy, do I have a huge couple of episodes for you today. In July, the White House talked about an AI action plan. Just a few weeks ago, they released a policy framework, basically a legislative request to Congress to back that up. And so I thought that it would be really nice to take this and to break it down in detail across a couple of episodes and to talk about what this policy framework means for AI in general in the US, and also what it means for AI in healthcare specifically, what it might mean for you as an AI governance professional, and what it might mean for you as a patient receiving healthcare from an organization which may or may not be using AI in your care. Before we dig in, I want to be clear about what this document is and isn't. It is a 4-page wish list, essentially, from the White House to Congress. So it is not a law. It is not a regulation. It is not an executive order like those executive orders were in July. As we walk through this, please remember that all of this depends on which of these legislative priorities Congress elects to pick up and which of them Congress elects not to move on. Regardless of whether any of this legislative agenda eventually makes its way into law, this sort of indication of where the Trump administration's thoughts are on AI policy and AI regulation, it still really matters, especially if you work in healthcare. So we're going to break this down into 2 sections. We're going to talk first about what was in the July America's AI Action Plan. We're going to talk about what's new in this particular legislative agenda. And then we're going to talk about preemption, FDA, and HIPAA and privacy, and wrap up with some child safety in this episode. Then in the next episode, we're going to talk about workforce provisions, and then some of what's missing from this legislative agenda, and some other proposals that might stop some of those gaps. And then we'll wrap it all up with its route from a bill to a law. Everybody's Schoolhouse Rock jingle is in their head, and that'll conclude our little 2-episode arc. So let's get started. The July America's AI Action Plan was really built on 3 pillars. So the Trump administration wanted to accelerate AI innovation. They wanted to build infrastructure, that's data centers and power centers, so that AI could proceed without being bottlenecked by data or by energy concerns. And then they explicitly wanted the U.S. to lead internationally. This was accomplished through 3 executive orders. There was no Congress required. This is something that the president can just write, sign with his fancy pen, and be good, basically, and be ready to move forward with. So in particular, there are a couple of things that I want us to remember from that series of executive orders from last year. One of them was the Preventing Woke AI executive order and this sort of debate about ideological neutrality. So although we talked about this last year, although we agree on the surface that ideological neutrality in your artificial intelligence is absolutely a worthy goal to shoot for, banning particular terms is not the way to do it. This is much more subtle than that. Silence on bias and equity in July, that continues through this legislative agenda, and we're going to talk about this in more detail in our next episode. Another idea that occurs in both of these documents is this sandbox idea. So the sandbox idea was in the July plan, and it appears again in this legislative agenda. Explicitly, Congress should establish regulatory sandboxes for AI applications that help unleash American ingenuity and further American leadership in AI development and deployment. And then, additionally, we're going to seed those sandboxes with some data, because the legislative agenda says Congress should provide resources to make federal data sets accessible to industry and academia in AI-ready formats for use in training AI models and systems. That is really cool. That is a marriage of both a framework, like an organizational concept, and data to do that sort of training on that you often don't see. You'll hear people talk about, oh, we need public resources, we should definitely do some sandboxing. It's nice to see these 2 practical things being married together. Okay, what's new about this legislative agenda is, in fact, the escalation to Congress. So whereas the executive orders from last year were a direction, basically we're saying, this is what we can accomplish from the office of the president alone. Now what we have is a 4-page document of legislative recommendations from the White House. So this is not binding, but it is explicitly addressed to Congress with a request to pass this law this year. It is broken down into 7 pillars, and I do want to talk about these, although we're not going to cover them all in depth. The first is protecting children and empowering parents. This is building on some of the safety and privacy mechanisms that were evident in the previous policy, including provisions for deepfakes and for preventing the use of AI for sexually explicit material. Number 2, safeguarding and strengthening American communities. Number 3, respecting intellectual property rights and supporting creators. And although we are not going to dive into this, I do just want to say that for the record that the administration in this particular pillar says that the correct area for determination of who owns copyright and whether AI training on copyrighted materials constitutes fair use or not is the court. They have turfed this to the court. They have not made a federal policy stance on this. Number 4 is preventing censorship and protecting free speech. Always nice to see our civil rights represented. Pillar number 5, enabling innovation and ensuring AI American dominance. Number 6, educating Americans and developing an AI-ready workforce, a topic near and dear to my heart. And then pillar number 7, establishing a federal AI policy framework, preempting cumbersome state AI laws. So today we're going to go deep on some of the ones that matter the most for healthcare. We're going to talk about the preemption. We're going to talk about HIPAA and other privacy laws, and we're going to circle back to that protecting children and empowering parents because there's some interesting nuance in there for healthcare. Educating Americans and developing an AI-ready workforce, as well as what's not in this document. That'll be in episode 2. So hang tight, we will get there, I promise. Okay, so let's talk about establishing a federal AI policy framework, preempting cumbersome state AI laws. That is a mouthful of a header, my goodness. But what it really means is that what we would like to have, what the Trump administration would like to have, is one national standard for AI policy, not 50 state standards. And they say this literally in the legislative agenda. They say Congress should preempt state AI laws that impose undue burdens to ensure a minimally burdensome national standard consistent with these recommendations, not 50 discordant ones. I mean, we've talked about this extensively on this podcast before. When you're a multi-state organization, whether you are a tech company or a hospital or a university, it does matter whether you are trying to navigate a single national standard or a bunch of different state laws. What I do want to call out here is that there are carve-outs in this preemption question. And for healthcare, these actually do kind of matter. So states do retain, under this legislative agenda, their traditional police powers to enforce laws, including laws to protect children, prevent fraud, and protect consumers, as well as requirements governing a state's own use of AI, whether that's through procurement or services like law enforcement and public education. So the gray zone, states that have transparency laws around the use of AI, like California or New York, do they survive? Does New York City still able to say, oh, you must tell somebody if AI was used in their, that's not what the New York law says. New York City says that you cannot use, maybe let's not record this while I'm scratching my back. New York City says that you cannot use AI in hiring. Is that what the New York law says? I'm not actually sure. New York's laws regarding the use of AI in hiring, do they survive? It's really unclear. The framework does not say. The framework also kind of doubles down on something that I learned about actually this week for the very first time. It's Section 230 of the Communications Decency Act of 1996. This is a charming piece of legislation. I really love the idea that something can be called a decency act. What this does is it protects internet platforms from legal liability for content posted by their users. So the short version, the intent is if someone posts something harmful on Facebook, you can't sue Facebook for it. You can only go after the person who posted it. I will say that in the past week, we've seen recent judgments against Meta and Google for the encouragement of the use of social media by their users, which indicates that courts are open to some nuanced interpretations of this law. But the legislative recommendations themselves are very clear, that states should not be permitted to penalize AI developers for a third party's unlawful conduct involving their models. This sounds to me like the liability for health AI is going to remain with the health systems and with the MDs and the RNs who are using the tools. Which means that if you are a governance professional at a health system, if you have been thinking about state law compliance for your AI governance framework, keep an eye on this. This doesn't preempt state law yet, but this is definitely the direction that the federal government is heading. The floor might shift, but until it does, you still have this patchwork of multi-state regulations. Don't stop complying with the state laws today because of a document that isn't a law yet. And always be aware that there is no legislation that the federal government can pass that is going to remove your requirement to use AI safely. That is a moral obligation. That is not something that can be legislated away. So let's talk for a moment about regulations. So the framework explicitly tells Congress, do not build a new AI regulating agency. It literally says Congress should not create any new federal rulemaking body to regulate AI and should instead support development and deployment of sector-specific AI applications through existing regulatory bodies with subject matter expertise and through industry-led standards. So just like our privacy standards in the United States, we don't have one federal standard. We have sector-specific privacy standards. So for healthcare, we are going to be relying on our specific regulation and regulatory bodies to regulate our healthcare AI. That sounds an awful lot like software as a medical device. That means FDA. FDA is going to be our designated gatekeeper. So it is helpful to know that there will not be any sort of new national office of AI regulation. It does mean that we are playing with our friends in FDA with their principles and their priorities that we generally have a pretty good understanding of. FDA is already, though, under pretty significant capacity constraints. Their staffing is down roughly 15% from 2023, and they are being asked to absorb oversight of this accelerating AI market and stand up these regulatory sandboxes that were called out in July, and as well in this. They're asking that Congress should establish regulatory sandboxes for AI applications to speed American innovation, essentially. FDA has just gotten 2 new scoops of duties with 15% less people. Yikes. So what does this mean? This means that the heat is on FDA to do more with less and to speed these innovative AI tools to market. What that means for us in healthcare, though, is that passes a lot of the responsibility for validation and especially for post-deployment monitoring down onto the health systems that are actually deploying these tools. There is no FDA clearance that is going to be a substitute for the work that your health system is still going to have to do on the back end. Okay, so what does this mean about HIPAA, right? No new rulemaking body and relying on sectoral regulators means that the Office of Civil Rights is going to remain the primary enforcement vehicle for healthcare AI privacy concerns, right? But we have not received any new guidance on what AI-specific compliance might look like. So HIPAA is the baseline, but it was written before AI really kind of exploded. Section 1557 of HIPAA, effective in May 2025, introduces non-discrimination standards for AI and patient care decision support tools. There is no signal in the legislative agenda that any of our privacy legislation will be updated to address further AI-specific use cases. So that is important and good to know, right? We're not enforcing new privacy regulations based on the technology. We are, in fact, leaving that out to speed innovation and to help, essentially, at least in healthcare, the goal is to help more patients better, faster. That's the goal. There is an interesting wrinkle when it comes to the data of minors. So there's a call out in the legislative agenda that says Congress should affirm that existing child privacy protections apply to AI systems, including limits on data collection for model training and targeted advertising. So if we have AI systems they're being used by children, by minors, we should make sure that they have limits on that data and that we're not doing targeted advertising to our children any more than we are permitted to currently by the rule of law. For governance professionals, this document does not mention HIPAA by name. That is, in and of itself, a data point and a message, right? We are on our own to interpret how our AI tools interact with PHI. That's not new. We've been on our own before, but this legislative framework is not going to create clear criteria or standards for us. We are going to do that ourselves. Let's talk really briefly about child safety as well, because the child safety pillar is what this document opens with, and it is the most straightforward section of it. Not a coincidence that this is the area with probably the most genuine bipartisan support. This legislative framework asks Congress to require age assurance tools for AI platforms that are likely to be accessed by minors. And as a parent, you can attest that would be fine. The document also asks Congress to mandate platform features that reduce risks of sexual exploitation and self-harm. It also references the Take It Down Act, which prohibits the non-consensual publication of, they call it intimate visual depictions. It's deepfakes. It's deepfakes for sex reasons. It actually requires platforms to remove them starting in May 2026. The Take It Down Act does. So our legislative framework that we're talking about today explicitly carves state child protection laws out of preemption. So if your state has laws around AI-generated child sexual abuse material, for example, those survive. That is a nice exception, a very meaningful exception in an otherwise really broad preemption agenda. For healthcare, we're going to sit with this self-harm provision for a second because this is really not an abstract concern in our space. Think about our discussion of ChatGPT Health last week and when those self-harm crisis intervention messages triggered and when they didn't. Remember my favorite line from that paper, users will present with emergencies regardless of design intent. And we might also say that minors will use tools regardless of age assurance. They just will, right? When I was a child, I knew how to access books and areas of the internet that my school's guardrails thought that they had prohibited. Any reasonably motivated teenager will find a way to get around these, right? right? Whatever we put out there, kids are going to use. And no matter how many disclaimers we have, people will use it for mental health emergencies, regardless of your design intent. If you are building patient-facing AI tools, assume that minors will use them and that they will use them for mental health purposes. The framework, the legislative framework, says platforms should implement features to reduce risks of self-harm to minors, but it doesn't say anything about how that requirement would interact with clinical AI tools, or whether, like a patient-facing mental health application inside a health system would be treated differently than a consumer chatbot. And to be fair, I wouldn't expect to see that in a legislative agenda like this, right? That is way in the weeds. This is really a high-level directive saying, hey, Congress, please focus on these areas. We would like laws passed to govern these areas. There's some legal analysts that note that the framework kind of cautions against open-ended liability in the space because the litigation is really real, but that caution also means that who owns that accountability for what happens if you provide a mental health tool to somebody and it does not go as expected? That accountability mechanism is still pretty vague. This is one to really watch as other legislation develops, because other legislation currently moving around in Congress goes further than this framework here, and child safety is the most likely legislative vehicle to actually move forward this year. So the framework isn't law. The process to make it law is just beginning, but it is already telling us something very important. The federal government's preferred posture is still speed, sector-specific oversight, and no new AI watchdog. So for health systems, that means that the governance responsibility is ours. It always has been. That responsibility never was with the federal government. It has always been with us. That is a little bit reassuring to me. So in our next episode, we're going to talk a little bit about the workforce section of this legislative framework, and then we're going to talk about what this framework doesn't say. And we'll talk about its road to full legislation. We'll find out what happens. Thank you so much for joining me on this episode of the Health Data Ethics Podcast. I cannot wait to dive back into this with you next week. Please stay tuned.